Let's talk about something that every single dog owner needs to know about, especially if you've just brought a new puppy home. We're going to break down Canine Parvovirus, or Parvo. Now, I know it can sound pretty scary, but understanding it is your best defense. We're going to walk through it all, step by step.
You know that feeling, right? It's the one that just sinks your heart. One minute, your new little puppy is a whirlwind of fun, and the next, they're just off. They don't want to play, they're not interested in food, maybe they've even thrown up. That sudden shift is incredibly alarming, and it's exactly why we have to talk about Parvo.
Okay, so let's get right into it. To really understand how to protect our dogs, we first have to know what we're up against. So what exactly is this invisible threat that can make a puppy so sick so fast? At its core, Canine Parvovirus, we just call it CPV, is a super contagious virus. Its main goal is to cause a really severe intestinal illness. And its primary targets? Young puppies, usually between 6 weeks and 6 months old, and pretty much any dog that hasn't finished its vaccinations.
So how does it do so much damage? Well, think about a puppy's body like a brand new city under construction. Things are being built everywhere, super fast. This virus, Parvo, is like a saboteur that goes in and specifically targets the busiest construction sites. And in a puppy, that's the lining of the intestines and the bone marrow, which is the factory for all their immune cells. So you see, it's a devastating two-front attack.
Now this is the part that's, well, a little terrifying. The virus's ability to survive is just incredible. It spreads through contact with infected feces, sure, but it doesn't have to be direct. This virus is unbelievably tough. It can hitch a ride on your shoes, on another dog's paws, or in a shared water bowl. And it can just hang out in the environment, your yard, the park, for months, sometimes even for years, because a lot of your typical cleaners won't even touch it.
All right, so that brings us to a really important question. Which dogs are the most vulnerable here? Because understanding the risk factors is everything when it comes to keeping them safe.
Okay, the highest risk group by far is puppies between 6 weeks and 6 months old. This is a really tricky time because the immunity they got from their mom is starting to wear off, but their own little immune systems aren't strong enough yet. Of course, any unvaccinated dog is at risk. And interestingly, for reasons we're still figuring out, some breeds like Rottweilers and Dobermans just seem to get hit harder by it.
So if you've got a puppy in that vulnerable group, what do you need to be looking for? Knowing these signs is absolutely critical, because with Parvo, every single hour counts.
The scary part is how fast this all happens. It usually starts small. On day 1, your pup just seems tired, maybe turns their nose up at dinner. They're just not themselves. But then, within a day or two, it explodes into severe vomiting. And by day 3 or 4, you'll likely see the biggest red flag, really awful, foul-smelling diarrhea that very often has blood in it. This 1-2 punch of vomiting and diarrhea leads to dangerous dehydration incredibly fast.
If you see those signs, the next step is simple. You have to act immediately. I know a trip to the vet is stressful, especially when you're this worried. So let's just quickly walk through what to expect. Being prepared can help you stay calm.
First things first, call your vet. Don't just show up. Tell them what's going on and say you're worried it might be Parvo. That lets them get an isolation area ready. Keep your sick puppy completely away from other dogs. Once you're there, the vet will do an exam and a quick test on a poop sample. It's called an ELISA test, and you'll have an answer in about 15 minutes. They'll also almost certainly want to run some blood work because that attack on the bone marrow we talked about causes a big drop in their white blood cells.
Okay, deep breath. We're at the most important part of this whole conversation now. Treatment, recovery, and a genuine, real message of hope. Because a Parvo diagnosis is serious, but it is absolutely not a death sentence. Just look at that number. With quick and aggressive care from a veterinarian, the survival rate for puppies with Parvo is between 85 and 95%. That's huge. That is an incredibly hopeful number. The key? The entire secret is acting fast and getting them the professional help they need to win the fight. So, how do we get them to that amazing survival rate? Well, there's no magic pill that kills the parvovirus. Instead, treatment is all about supportive care. We're basically the puppy's support crew while their own immune system fights the battle. That means we give them IV fluids to rehydrate them, anti-nausea meds to stop the vomiting, and antibiotics to prevent other infections from taking hold while their defenses are down. We also focus on getting them nutrition to help that damaged gut start to heal. It's intense, but it works.
If you only remember one single thing from our chat today, please let it be this. Vaccination is everything. A complete and properly timed vaccine series is the best and really the only way to truly protect your dog from ever having to go through this horrible disease.
It is safe, it is effective, and it prevents an unimaginable amount of heartache.
Remember, this information is for educational purposes and is not a substitute for professional veterinarian advice. If you have any concerns about your pet's health, please consult with your certified veterinarian. They are your best resource for ensuring your companion lives a long, happy, and healthy life.